Welcome to Lunch with Dr. Coopwood podcast, where we talk with a member of the Regional One Health family about premier behaviors. Today's episode, I'm joined by Ms. Angelita Rodgers. As an emergency department manager, Angelita has overseen the care of patients who are dealing with medical crisis. And starting this month, she'll be taking on a new role, which we'll talk a little bit about, as Director of Nursing Medicine Services. Congratulations.
Thank you.
It is not for the faint of heart. Patients come to us in pain, frightened, and stressed, and it's up to Angelita and her team to help them physically and emotionally deal with their problems. Therefore, it's essential to find a personal motivation, a reason to get up every morning and do the difficult yet critically important work of taking care of our patients in the emergency room. That makes Angelita a great person to discuss this week's premier behavior. Know my why. It's an important topic for all of us because our hospital never shies away from challenges. And that can feel overwhelming at times. But if you can identify the reason why you went into healthcare and what passions you have that keep you in healthcare in your career, it helps you keep going. So, Angelita, let's talk a little bit about that. Before we explore your why and the talk about how all of us can find our why, tell me a little bit about you and your role at Regional One Health and the journey that brought you here.
Okay, sure, Dr. Coopwood. As you said, I am the nurse manager of emergency services, and we take care of patients when they are at their worst. So they may be going through challenges with their health, but also going through challenges that we don't know about, economic challenges. So it is our part to make a positive impact in their lives. I got here into nursing by happenstance. At first, I did not want to be a nurse. My goal was to be an architect. I went to school for architecture up through my junior year, and I did have my second child while in school, and it became a challenge for me to balance the two. So I took a job out in California in the construction realm where I was a site supervisor for construction projects. And of course, being a 20-something, bossing older men around was challenging. I did it for 6 years, and then I decided I wanted to change, and I became a pharmacy tech, compounding in a place called Baxter. I'm sure you're familiar with it. And then I started my journey into nursing after my grandmother passed. Even after I started nursing, my desire was not to go into leadership. I wanted to be a CRNA until I got an opportunity to shadow a CRNA, and I realized how boring the job was. And no offense to any CRNA, it just did not seem like it would be purposeful to my purpose, which was making a positive impact in patients' lives. I wanted to be able to talk and interact with the patients that I provided care for.
Well, that's an interesting, circuitous way that you got into healthcare, and we all have different stories. I'm very grateful to hear yours. As you came into this from a different career, from construction to ultimately into nursing, what drew you into this field? You said after your grandmother died. But what drew you into this field instead of your other options, and what was it that appealed to you about healthcare, and how did it help you discover your why?
Well, like I said, making a positive impact in the lives of others. You can do it in many different professions, through education, through building somebody a house. I did do a lot of work with Habitat for Humanity in my construction career. However, my grandmother at a younger age pushed me into healthcare, and I always avoided it because I want to break the barrier in a profession where women weren't common. So I was always the person that was stubborn and wanted to challenge the status quo. But eventually, I did go into nursing as a tribute to her, and I realized that was actually my purpose. Being able to make somebody smile when they're suffering with cancer or helping somebody's grandmother walk again. those are all very near and dear to my heart. Even bringing staff members in and encouraging them to push further ahead with their education are all ways that I like to make a difference. So nursing has been very rewarding in many fronts, not just with the patient care, but touching the colleagues and touching the people that I manage.
That's important. It's interesting. I talk to new hires in orientation every other Monday, and one of the things that we talk about knowing their why is there's a lot of easier ways to make money. So if you're in healthcare for the money, that's not enough to get you through those long nights, those difficult patients, those difficult patients and that you see on a daily basis in the emergency room. So it's important that every individual who's listening to the podcast or who has a job in healthcare, and especially at Regional One Health, our organization, our patients need them to be very clear about their why, because that's what drives us and that's what gets us up in the morning. So when you align your why with the goals of the organization, how does that help you to lead to better patient care?
So as a leader, when your why is aligned with the organization's mission, values, and goals of care, you can project that onto your staff through empowerment and encouragement. Generally, I will introduce that concept to the staff when I first interview them. You have to come in here with compassion, and I'm going to be the leader that drives you to do more. You may be happy as a bedside nurse, and I'm not going to force you to go and go back to school because your circumstance might not allow that, but I will present those opportunities that enhance your learning, whether it be sending you to conferences, whether it be providing you with continuing education to understand how we can make a better impact on the people that we serve. And I think encouraging and empowerment are the biggest keys to ensuring that our staff are providing excellent care to our patients, because if you empower them to do the right thing, they're going to want to drive that needle forward when it comes to our strategic vision, because they want to be successful, and that's what I ingrain in them is be successful in yourself, make yourself push for your own purpose.
Mm-hmm. Well, that's important. Now, you manage people in the emergency department and in critical care areas in a high volume. We are known for our high volume, whether it's trauma or critically ill medical patients. And we deal with some degree of burnout sometimes. And how do you, what happens if one of your team members either doesn't know their why or forgets their why, and how does that affect them, and what do you do as their leader to kind of reset them in where, to realign them with where their why should be?
All right, so rounding is one big thing. I do have a poster where I had all of my staff members write why did they come to work for Regional One Health. And so every day it's a reminder to them when they walk in that break room why they're here. And everybody from our patient service clerks to our ancillary staff to our EVS team has written on that board. So every day they come in, they may be having a bad day. They can read an excerpt from one of their colleagues or from themselves to say, okay, this is why I still come here every day. But you have to constantly remind people in the time of turmoil, say for instance in COVID, remind them that, hey, what if you weren't here to care for this patient's loved one? What if somebody wasn't there to care for your loved one? How would that impact you when that's your family member? So just bringing it back to personalization, making it about how would you want your family member treated? If you had to take on an extra load, is that better than that patient not having a nurse to care for them at all?
And that kind of ties into my next question I want to pose to you. You're working with someone as a leader or beside someone as a colleague that knows their why, but it's totally different than your why. How do we work together productively when we're sometimes motivated by different things, and how do we keep the focus of the patient at the center of those motivations?
So everybody's different. You have to gain understanding of your audience, whether it be your friend, whether it be your colleague. You have to understand what drives them, and it's very important uh, to reach strategic goals or to provide excellent patient outcomes, because you have to see what that person is good at. I may be good at numbers and problem solving. Dr. Coopwood may be good at socializing with others. Does that mean that his skill set is better than mine? No, it means that your skill set can be used to achieve the same goal, but in a different component. So, kind of starting backwards generally is what you do. Is you look at what are we trying to achieve here, and how can each person be instrumental in achieving this goal, because you're going to need somebody to cover every part of that goal, whether it be numbers or whether it be communicating with the public. But everybody has a voice and has a nugget to offer towards that goal.
That's interesting. So I'm a big socializer. Is that what I just heard you say? No, that answers the question very well. You've been part of a project in the emergency department that is very important to understanding the why and why we come. I talk again in orientation to the new hires, and I say everybody in our ICUs was headed somewhere with an intention of getting there. And for whatever reason, they find themselves in our trauma ICU. So they come to us for care. They come for us for compassionate care and creating exceptional experiences. And they don't come with the expectation that we're going to do harm. And so this project you've been working in goes directly to this why. So tell us a little bit about the work you've been doing to reduce harm events in the emergency room and throughout the hospital, even though today that's not part of your role, but it soon will, and we'll get to that in just a second.
Okay, so back in 2019, if I can remember correctly, Dr. Coopwood, you had us all in the boardroom, all the leaders in the boardroom, and you challenged all of us to drive the harm events down. And you said that everybody plays a part. And generally in emergency services, we don't really associate harm events with outpatient ERs. So my brain got to turn, and I said, well, we could do something. And so the very next day, I actually implemented a project after speaking with wound care to see what could we do to help drive these harm events down. And one of the things is putting your eyes on the patient to see what they have when they got here, and making it intentional, putting your eyes on the patient. So we log roll our patients every time they come into trauma. So why not put your preventatives on that patient when they come through the trauma room? Implement the same thing on our medicine ED side. And we were able, with that project, to drive the heel and sacral pressure injury numbers down significantly by just doing that extra step when a patient first comes to the unit. Additionally, we were able to capture our present on admission wounds when the patient came to the ER. Now, this was in 2019 and went through 2020. We saw major success in that, and then we continued to do it in our ERs, but it never translated into the inpatient setting until this year. So we kind of restarted that project up throughout the hospital, one, so that we could get standardization of practices, and two, every patient comes to everybody's unit. So that's the common theme. Everybody gets a patient. So when the patient comes to your unit, you can do the same thing. You look at that patient, you identify if there's issues, and you put those interventions in place immediately so that your workflow is not interrupted throughout the day. Because when we get busy, it's hard to go back to the task that we may deem as not as important as giving the medication.
Well, that's an important concept that you just talked about, where I use what I do in my area, and then how can I leverage that across the organization? And sometimes organizations are so siloed where, she's in the emergency room. She can't tell us what to do. We're taking care of patients up here on the floor. But obviously what you did caught the eyes and attention of leaders. One of the things that I love to see within the organization is opportunities for individuals who have great leadership potential to be able to be promoted when opportunity exists. So tell me a little bit about your new role and how what it is and what all you'll be responsible for and what you're looking forward to.
Okay, so my new role is director of the medicine service line, and that's medicine from the ER all the way up to the ICUs. And it's a different concept because generally you have separate directors for each. But what I see working well, because I have med-surg experience, I have ICU experience, I have ED experience, you're able to connect the dots from the top to the bottom, and you're able to get those leaders involved in understanding and thinking outside the boxes. How do we help our team get to the goals that we set forth? Whether that's offloading our ERs, whether it's offloading our ICUs, whether it's decreasing our throughput numbers by pushing each other to get these patients out in a timely manner and identifying those discharges early. So my role will be overseeing the leaders that oversee the teams. And I'm excited to empower them to do great things because all of them have different strengths that they bring to the table. And I just want to tap into those and highlight them and push the organization forward.
Well, first of all, congratulations. And I look forward to and there's a similar role on the acute care, on the trauma side. And so this is something new that nursing is putting together. So I'm excited to see how it works out. And again, congratulations. So before we end this Lunch with Dr. Coopwood podcast, I just have one more ask of you, and that you would leave us with some tidbits or advice that we all can use as we go about our work. What are your suggestions for identifying a person's why and trying it in their specific role at Regional One Health? Whether that person has direct patient care responsibility or they're supportive to the patient care.
So just asking the question, rounding your team, ask them why are they here? Why do they enjoy coming to work every day? And then when they do identify that, you make a connection to our vision and our organization, and you remind them of that daily, especially when they're having a hard day. You have to remind them of why they said they were here. And I think if you know everybody's individual why on your team, you can push your team to do great things.
Wow, that is important because as leaders, we not only have to do our job, but we have to watch our team members. Especially during COVID, there was so much burnout and so much concern for team members, not only trying to keep COVID out of their home, but also taking care of patients who some were dying from this disease. And so as a leader, you have to have your eyes wide open to be able to spot that. So that's extremely important. Well, Angelita, thank you for joining us today and sharing your why. It has been very insightful and helpful, and I hope everyone who watches and listens to this podcast can better understand their why and go about going and clarifying that if it's not clear. In healthcare, we like to say it is our primary focus is on our patients' needs. We're off to a good start. If you start from a place of a compassion and wanting to provide the best care possible, you will naturally do the right thing by our patients. I encourage everyone to find a reason to do that. Your why doesn't have to be the same as my why or Angelita's why or anyone else's why. It just has to be your why. Find that thing that motivates you. Reflect on what you love about your work. Remember why you decided to join to do this job in the first place. And if we start each day by remembering our why we're driven to do the essential yet challenging work, we can meet our patients' needs and support one another. Thank you all for tuning into this episode of Lunch with Dr. Coopwood. We'll look forward to seeing you the next time as we explore another premier behavior. And Angelita, congratulations and much success on your new role.
Thank you, Dr. Coopwood.
You've been listening to Lunch with Dr. Coopwood, a podcast series that features Dr. Coopwood in conversations with people around Regional One Health and elsewhere who are making a difference with our premier behaviors.